So now let's see the sign and symptoms. So right-sided heart failure. So as we already talked about it, so peripheral edema, that is one of the signs for right-sided heart failure. There may be questions in the NCLEX or the REXPN exams about the types of heart failure. So you have to pay special attention to the symptoms of heart failure. So as you see, the right-sided heart failure has peripheral edema, jugular vein distension, abdominal distension, hepatomegaly, anorexia, nausea, nocturnal diuresis, weight gain. And what other thing is, there can be increased blood pressure or there can be decreased blood pressure as well. Okay, so this is something to remember. It's same on both sides. Okay, so let's have a look at the left-sided heart failure. So as we talked about, so there is effect on lungs when there is left-sided heart failure. So pulmonary congestion as expected, right? And dyspnea or tachypnea, crackles, cough, paroxysmal nocturnal dyspnea, and then increased or decreased blood pressure. So if you pay special attention to the left side of the heart failure, so see, look, what does it explain to us? That means there is effect on the lungs, right? On the right side of heart failure, there are the different symptoms. When it's more focused on the left side heart failure, there are going to be symptoms like pulmonary congestion, dyspnea, crackles, and cough. Okay, so keep that in your mind. So next we'll talk about the treatment. So I just kept it simple here for you guys. So there are two different types, of course, non-pharmacological and pharmacological treatment. So non-pharmacological treatment, pay attention to the diet. They're supposed to be on fluid restriction and on the low sodium diet. Okay, so as we talked about the blood pressure here, increased or decreased blood pressure, so we have to do the health teaching for a patient that change the position slowly, especially when they're going to be on the medications for the blood pressure, heart failure. There is a risk for them to have orthostatic hypotension, and there is a risk for the patients to fall. So as we know, the patient safety is our priority, so make sure you pay attention to that as well. Okay, so daily weight monitoring. So when there is going to be backflow of the blood, and there is going to be peripheral edema, so there is, what's going to happen? There is going to be fluid accumulating in the body, and that's going to result into what? Weight gain. So we have to keep an eye on the weight. Okay, so daily weight monitoring, stockings, and then for the diagnostic test, we should be monitoring the blood pressure and BNP levels, right? So now let's talk about the pharmacological treatment. So as you see, these are all the cardiac drugs right here. Okay, so ACE inhibitors that ends with tril, I wrote it here. ARB, calcium channel blockers, beta blockers, cardioglycosides, vasodilators, and diuretics. So we'll talk about the cardiac medications in a different